Алина, 18-й слайд тоже множественный выбор, нет? Алина, а 18-й слайд тоже множественный выбор?
Сейчас я посмотрю, подожди. 18-й слайд, 18-й. Что-то не помню, то ли интернет сегодня тупит.
Там опции, там варианты выбора есть.
Да, там опции, да.
То есть один вариант, правильно?
Один вариант, да. Множественный выбор только в одном.
Хорошо.
Да.
Guys, it's 1 o'clock.
Yes, guys, it's 1 o'clock and we can start. So it's a pleasure to see everybody here on our regular webinars, online seminars. Right now it's a trend. As I saw, you know, I participate in, I think in 2-3 daily, some online education, some meetings and so on, and Zoom, Skype, and Google Hangouts, you know, my friends right now, my favorite software. So guys, how are you? How is it going?
Good morning to all. I hope everybody is safe and everybody is, thanks for joining us today in this session.
Hi, everyone. Good morning, good evening. Hope everyone is doing great. We're almost ready to start. Let's wait maybe a few more seconds to get everyone together, and we're ready to start.
Yes, and I think if you here as well, please make a plus on the comments. If you have good sound and hear us clear and loudly, please make a plus to the comments. And we will see that everything is okay and we can move forward. Good afternoon, yes. Audio is loud and clear. Thank you, Daniel. Hello, Felix.
Felix is from Pondicherry.
A lot of people join us this day. It's our pleasure to see you guys. Don't hesitate to ask us any questions to the comments. Hello, Santosh. Hello, Chris.
Hello, Mahin. Welcome.
Yeah, that's great. I think we can move forward, Sean, and start with part of one of the interesting and the most important parts in our job. And I think our colleagues will check what we have, some special recipes of success from Russia, and let's exchange our knowledges.
Okay, so Evgeny, do you ready to give me the word?
Yes, I'm ready to give you the word. And today with us, our brilliant rehabilitation doctor, Alina, who is, you know, I will call it like an angel for our patients, for their parents, because they are online, they are in touch with her, and, you know, together they can improve the way from the start, yes, from the start of only from thinking about installation and to the, you know, best practices, how to improve the wearing of prostheses for upper limb patients. So Alina, please, you're welcome.
Wow, Zhenya gave me a really high esteem. I really need to do really well today to meet his expectation and everyone's expectations now. Okay, so yeah, today we are going to talk about rehabilitation, one of the most important things as far as I believe it in terms of upper limb prosthesis and every type of medical help, I would say. And we are going to cover different issues starting from rehabilitation team and rehabilitation models as we are as we have tried to implement it here in Russia. And also I will share with you my own experience on the tests, on the practical things that we have been using and how does it affect actually the patient flow and at what price. So yeah, we're going to discuss different issues, and I know that there are a lot of very experienced specialists with us today online, and I would really love it to be interactive. So don't hesitate to text me on anything that I'm saying. I will be glad to start any discussion and keep a close contact with you guys. Yeah, thank you for joining us. And I have to figure out how to move on to the next slide. Yeah, so rehabilitation, why this part is important, basic techniques and way to organize in your clinic. Those are the main issues that we are going to cover today. And okay, Nikita, I will need your help probably switching the slides. Okay, I can see it now, yeah. So we've met before on our previous session, so I'm not going to take much time going into details of my background. I work in rehabilitation and I'm also a pediatrician, and I have a master's degree in healthcare economics, and my graduation work was on rehabilitation models. So that's pretty much what I've been doing for some time now. And going on to the next slide, I would like to start with a discussion with a short question. What forms success of the prosthesis fitting? So we all know that in some cases we put on a prosthesis and the patient wears it all the time and he's really successful and safe with it. And in some cases the patient does not want to wear and have a lot of issues, have a lot of problems. And I would like for us to have a small discussion on what forms the success of the prosthesis fitting. And I will be glad if you give your answer in the chat. Yeah, and we will discuss it online. Yeah, well, I see the first answers already. And yeah, that's all. That's all good. Patient satisfaction, yeah, it's very important how the patient reacted on the prosthesis fitting from the very beginning, and maybe a good socket, good hand and components. That's true. Good prosthesis and good socket is one of the key components, I would say. If the patient is not comfortable with the prosthesis, we can do a lot of things and it will not help. So when I get in touch with my patients and they're telling me I'm not wearing the prosthesis, the first thing that I'm asking is it comfortable? Like, I mean, physically comfortable? Because if it's not, I cannot motivate you, I cannot help you, and we have to start with making it comfortable in a physical way. Good team approach, yeah, that is one of the most important thing, and I'm going to talk a lot about it today. I put it in the word rehabilitation, and I will later on explain you why. Patient satisfaction and acceptance, it is correct counseling of patient, correct prescription. Yeah, making process helpful in doing daily chores for amputees. Yeah. Well, I totally agree with every statement that you've put here. And as for me, I keep telling the patients and keep telling the doctors that I would put the success of the prosthesis fitting in 3 main things in prosthesis. And it's what you have already mentioned: quality, assurance, socket, well, physical comfort. The second thing is rehabilitation. As you've mentioned, a team approach and well, a lot of things that we put in this term, and we are going to discuss it later on. And of course, the user, his loyalty, his mood, his psychological features. So yeah, basically everything that you've put on, yeah, motivation as well, as Evgeny mentioned. So this is a 3-component thing, and I'm pretty sure we cannot achieve 100% success if one of the part is missing. And we can affect the prosthesis, we can make it a really good quality, but without rehabilitation, I believe that 100% success is not achieved anyways. We can affect the user, we can improve his motivation, and I'm going to talk about it today. But there are some psychological features that we cannot change. Some people are optimistic, some are not that optimistic, but yeah, we'll have to work with what we have and trying to make the best of it with a good quality of the prosthesis and a good rehabilitation. So moving on. Is rehabilitation truly needed? I have to share with you my own experience here in Russia. We have a good rehabilitation in Moscow, but unfortunately in a lot of faraway regions, rehabilitation is missing. You know that Russia is a pretty big country and all regions have different, I would say, details of medical insurance, have different access to medical help. That's a bad thing to happen, but it is what it is. So I have to tell you that not all regions have a good medical rehabilitation in terms of upper limb prosthesis. And I have to do a big work explaining to the regions why do they need to put on rehabilitation solutions. So why do we need rehabilitation in terms of upper limb prosthesis? First of all, putting on a new device on your hand is hard, because it ruins your traditional pattern. So most of my patients are pretty confident and have a good quality of life even without a prosthesis. They can do everything with their own hands. So they have their traditional patterns, and when they put on a prosthesis, they have to relearn. They have to restudy and gain new patterns. That's a hard thing for a person. He needs a lot of motivation, a lot of help to do so. The other thing is a muscular fatigue. So the part of the hand is missing, meaning that there is a lot loss of weight, and then we suddenly put on a new weight on a prosthesis, and the muscles do get tired. So it's another hard thing, and a lot of patients complain in the first times that my hand is really tired. It's very hard for me to wear it for a long time because muscles are tired. The other problem that I usually face with children is a passive use of the device. So the active prosthesis is on, but the patient does not actually use the grab. So he passively moves objects, not manipulating with fingers of the prosthesis. That's also a pattern. The patient is not used to having fingers on this hand, so he's not used to manipulating with them. And it's also one thing that rehabilitation can help with. And another moment is psychological adjustment. Well, prostheses still don't look like a hand, and they're different, and that is why it's hard to cope with the fact that I'm not having a hand, I'm having a prosthesis, and it's a new stage of getting used to it, to your health, that everyone has two hands and you have a hand and a prosthesis. And also misunderstanding with the prosthesis is another thing, meaning that mainly with the bioelectrical solutions, you have to train your muscles really good so the prosthesis understand what do you want to do with it. I will share some more light on it later on. And so we've developed 3 stages of rehabilitation process. We have rehabilitation before installation, during installation, and after prosthesis installation. Some of the stages are online, so they're distant, because unfortunately we're not able to provide medical rehabilitation, well, inpatient medical rehabilitation all around the country. So some of the stages we've made online, and some of them are inpatient, so face-to-face with the specialists. And let's be specific about the parts, about the stages. So what we are doing before installation. Unfortunately, in a very rare cases, we're able to meet with a child or with adult in person, because they're usually from faraway regions. So we've sent them online via email, age-specific guidelines. So they're dealing with expectations. So it's in a very important part what to expect from the prosthesis and what to not expect. And you have to get the patient ready. And some of the managers sometimes are scared to tell that there are good things in the prosthesis and there are things that you will still not be able to do with it. But it's the right thing to do, because the patient has to know it from the very beginning. That is how he will not get upset later on. He will be prepared. And also this age-specific guidelines has psychological and physical preparations, some exercises, some psychological things to cover before putting on a device. And along with this age-specific guidelines, we send a questionnaire asking in terms of the patient, of the child, what does your child like? What is his character like? Does he want to get a device? What he's fond of? What toys does he like to play with? So we have to understand our user, his likes, his dislikes, his expectations, both children and both adults, because later on it will help us to provide individual approach to rehabilitation and to motivation. And of course, in a complicated cases, we have to get in touch by phone, by email. Sometimes we ask our patient to come to the clinic, to the office when the cases are very complicated. So this is another issue that we're trying to get along with. That's what we do before installation. And I have to tell you that I'm trying to tell every single user that so they know it before installation, that prosthesis is not hand. It has a lot of functions, but it's not the same as the hand. So please don't expect it to be the same, and don't expect it to fulfill all the function as normally hand does. This is an important issue that I'm trying to tell before installation. And in terms of children, I don't know how many of you work with children a lot, but I do.
Alina, could I interrupt you somehow?
Yeah, sure, go ahead.
My name is Marco Bruni. Sean did not tell to anyone. You know, my mission is to give a value and to track, you know, we give real value, not only talking something. Alina, why the previous slide, why the previous message is so important? When you are talking, hand is not, you know, the arm. It's not the substitute to the arm.
Well, because it forms the right expectations, and a lot of patients, especially patients after trauma, believe that the prosthesis is exactly like hand, meaning that they hope that when they put on a prosthesis, everything, their life will come back to what it used to be before the trauma. And it doesn't work this way. Yeah, the prosthesis can help you, but it doesn't switch your life from the ground to the top. It's your head that is in charge of it. So just by putting on the prosthesis, you cannot change everything that happened to you. You still have this experience behind you, and you have to move on living with it. So I have had a patient that been telling that when I had a hand, I used to go camping a lot. I used to go in mountains. I used to enjoy it so much, enjoy the nature, and I cannot go anymore. And I was like, why can't you go? And he's like, well, I don't have a hand anymore. And I'm like, okay, but how does it physically affect you not going? And he couldn't give this explanation because it's in his head. He made a decision for himself that without a hand, I cannot go. And there are no specific recommendation, do not go camping if you don't have hand. It doesn't work like this. So it's a thing that he put it on in his hand. I cannot go, I'm handicapped now, I cannot do a lot of things. And the prosthesis does not solve this problem. And in some cases, when you put on a prosthesis, the patient feels really enthusiastic for the first time. And then he understands that, well, it still doesn't feel like a hand. It doesn't have this tactile feeling. I have to provide an eye contact to make sure that everything works. And it's not a hand, and he feels disappointed, and he feels like people have been lying to him. So you have to put it in the very first place that prosthesis is not hand. It will help you a lot. It will help you in manual activities. Two hands to grab something, to I don't know, to eat and talk on the phone, and a lot of things it will help. It will help your health, but it will not substitute your hand to the fullest. That's what I always want the patients to understand.
Alina, thank you for explanation. As usual, I would cover this message in another way, you know, because my mind is more marketing and sales mind, you know, not scientific like yours. And dear ladies and gentlemen, I want to ask you, as a businessman, as a commercial guy who care about not only serving society, but who cares about cash flow and margin, what do you usually promise to your customers, offering them prosthesis, offering them upper limb prosthesis? Because you could answer in chat. You promise them everything. You promise them the substitute to the hand, you know, 100% substitute. You would go with your second hand and you did not even notice. What do you promise to them? I'm sharing my experience that being a commercial guy, I'm willing always to sell everything. You will be the best. You will, yes, it is like the usual hand, you know, everything will in your life will be the same, and trying to sell, you know. And yes, it is predictable and this is logically looks like true. But if we will now keep traction on what Alina says, we will lose this guy, you know, for the second or the third installation of prosthesis, because we promise him too much, you know, and we don't get his expectations, we don't match his expectations, and then we lose it. So this is only one-time deal. And if you want to be successful in commercial way, rehabilitation and treating people is very important. Understanding their needs and not promising them much, but talking to them in a fair way would make you successful, because they would rely on you and trust you because you tell the truth. That's why I wanted somehow to discuss with you this point. That's why we in Motorica consider it to be important.
I just love the way we have different approaches to the same thing. The marketing one and the medical one, and they still come to the same issue. Promise what you can do, don't promise what you cannot do, because otherwise you'll get in trouble. That's what Chris pretty much wrote in the chat. In other words, yeah. So we've discussed how do we work before the prosthesis, and I don't know whether you work a lot with children or not. I work a lot with children, and I love working with children, and to be honest, I like working with children more than with adults. And the common issue is when to install the device in terms of the child. And we have a lot of misunderstandings here in Russia, and a lot of doctors keep telling that you have to get a prosthesis when the child is about to go to school, or even later on when he has a better understanding. And it doesn't work this way at all. And the rule is simple, is sooner rather than later. So there have been a lot of researches showing that when you put on a device after 2 or 3 years of age, so at 5, 6, or 7, the rate of not wears are very high. So at 5 or 6 and 7 years old, child is having a very hard time getting used to the device because he has very strong traditional patterns, and it's very hard to learn something completely different. So the international recommendation is to put on a device, a cosmetic device, at 6 months of age, and then switch to the active device at 1 or 2 years old. So that it is the right thing to do. It's an easier this way. But we have to make sure that the child is psychologically ready for the active device. So he has to give us a feedback on the prosthesis fitting, that everything is comfortable and that he feels good in it. And he can contact through the mother, giving her some signals that he's comfortable or not comfortable. And the other issue is the stump size. Sometimes the stump is too short and we have to wait a little longer for it to grow so we can put on the prosthesis. And the other thing is parents willing to work with a child at a daily basis at home. And it's a very important issue. And when I'm talking to parents of small children, and every child basically, I always say that the success of the prosthesis fitting will be affected by you as a parent a lot. If you are ready to work every day, especially in the first 2 months, 2 or 3 months, you will be successful. If you don't have time, don't have resources, well, I'm pretty sure that you will have hard time getting used to the device, and probably your child will not wear it. So you will have to spend some time to help the child to get used. When the parents are ready and when they understand the need, they usually go for it. And when they have their recommendations as well. I will share some information on how do we share knowledges on getting used to the device later on. So I'd like to go one slide back and discuss what specialists work in your rehabilitation team. And we're switching to the inpatient rehabilitation during the device installation. So do you have the rehabilitation team? And what specialists work with a child or with adult when you install the device? Yeah, and there is supposed to be a survey, I think, isn't it? Marco, if you could start the survey,
yes,
I don't know.
Yes, I will. Yes, I will.
Okay.
Just a second.
And I can see a command that in low resource setting, like in India, we cannot follow theoretical protocols. It is dedicated by availability and cost of the prosthesis. Well, if you're talking about rehabilitation protocols, I will later on, close to the end, I will give you specific rehabilitation protocols that I truly believe are not very expensive to follow. So I can understand that to form a team, yes, it is pretty pricey. You have to find a specialist, you have to give them salary, you have to give room for them to work. And I will give you options in case you don't have this source. But at this moment, I was thinking that, you mean prosthesis fitting.
This is actually Dr. Pooja I told you about, Elena. She's asking the questions.
You mean prosthesis fitting? I'm not sure I quite understand the question from Pooja. You mean you cannot follow theoretical protocols in terms of the age of fitting the device? Is it the thing that can be hardly followed or not? And also I can see the other question about the price. I'm not sure how and what is your plan to operate in India. Well, I'm not a price person because I'm not, I even don't know the prices. I'm a doctor. But if Evgeny or Marco could give some details about the prices, I can understand that it's important to know, because it's one of the basic things to understand if it's affordable or not. So
yes, of course. Our colleague Valerie, she will ask our colleagues from India about this question and explain everything. And if you have some questions about the pricing or how to interact with Motorica right now, yes, how to get the product or to see what we have, you can contact Valerie. She's on chat and she's in touch with you. Also, you can chat our Sean Kennedy. Yes, he's from Mumbai and he can guide you how we can serve you the best way. Thank you.
Yeah. It's not like we don't want to share the prices online. I just don't want to know it. So there is no way I can tell you these details. We have a lot of pediatric amputees, but can't fit at the optimum age. At age 6 months, we're able to fit much later in life. Yeah, that's a common problem. And we also have the same issue in Russia. It's not always the parents or the doctors that don't want to put on the device or don't tell that there is a need for it. But sometimes the parents cannot afford some part of the processes because in some regions they have to pay some part of the price from their own pockets, from their own resources. So yes, some patients cannot allow to have the prothesis on time. And it's an issue because the other issue that is hard to deal with children is that they keep growing. So you basically have to change the prothesis every year, and it's also a big price. But yeah.
Alina, I will show you now the summary of the survey. Everybody will see it on the screens because more than a half already, made their choice. That's the story. And please look into the questions and answers session because your point about prosthetics is not a hand, meet a warm support and reaction from people, from Ashish and Pooja.
Mm-hmm.
Here are the results
on
the screen.
Yeah, that's what I was expecting pretty much. I mean, almost 50%, no specialists at all. Yeah. Well, I think it will be interesting for you to know how we organize it here in Russia. And again, you don't have to copy it the very same way, but maybe you will just take some of the ideas, and later on I will share what to do if you don't have the specialist or don't have the source to do so. And again, yes, I'm sorry that in India not all patients can afford the prothesis for their child because there is no insurance. And I truly believe that there should be insurance for things like this, and it's a big governmental problem and a big question to the government. Why don't they provide the children of their country with the upper limb prothesis? Because that's something that what they need for their health and for their future life. Say, I'm sorry you don't have an insurance for that.
Alina, I think we could comment this issue together with Evgeny or separately. I don't know. Evgeny is a boss to decide. In Russia, the country I love, and the flag you see on the T-shirt of Evgeny Konev, part of our success is a very proactive position and collaboration with the government, forming these laws, this support issue to the handicapped people. So this is the part of our mission and part of our activities. opening the Indian market, we also now negotiate with the people who are inside of this system on the government level of India, you know, understanding clearly that this is not only the point of, you know, to make the prosthetics or to find people who need them, you know, but also some support, some program of support from the government, from the business institutions, from the NGOs and whatever. So I just want to mention that we also invest our activities in this sphere.
Yeah, and
Thank you,
as far as I know, for example, in Belarus, they also didn't have an insurance for the prostheses, and we as a team somehow got in touch with the leaders of the rehabilitation system and medical system in the country, and now a big part of the prostheses is covered by the government as well. So there is always a room for change. You just have to know to whom to talk, and it's a hard thing, and I understand as a doctor that you're trying to make something good, and sometimes it cannot work this way only because the system does not allow you to. So yeah, I'm totally on your side with this, and I'm thinking that if there anything we can do to help, we will totally try to do so. So let's try to switch to the process of installation and rehabilitation team. So in Moscow, I will be honest with you, the system that you are saying is right now used in Moscow and in one more city in Russia called Perm. And it's not the government who is paying for this, it's also our company. So we just came to the understanding that we have to invest in rehabilitation because there is no other way we can make sure that the patient is wearing and will come back for the next device. So rehabilitation team works under the doctor of rehabilitation medicine, and he's in charge of kinesiotherapist, occupational therapist, and clinical psychologist. And on the next slide, I will show you a video of the teamwork. I don't know if it will be comfortable for you to see because I know that Zoom cuts off the quality and it's a little bit slow in terms of video, but let's try anyways. There we go. So we've basically got along with a private clinic and to work with occupational therapists, psychologists, and physiotherapists as a team. And the team has to be supervised by someone. And in our case, it's doctor of rehabilitation medicine, me, or another specialist who works in clinic actually. So doctor of rehabilitation medicine sets goals for the rehabilitation and controls and coordinates the process. And well, I don't know if it seems to stop completely. Let's see, yeah. And here online you can see the girl working on with a physiotherapist and with occupational therapist. So occupational therapist basically works with using the device, and physiotherapists working with general health. And I will later on go through more details on how do the specialists work and what are the main goals. As a physical therapist, you have to have a degree to do it. So you have to have special knowledges, as well as a clinical psychologist have to have clinical knowledges and know the general approaches to the psychology. But in terms of occupational therapists, I'm pretty sure that you can share these responsibilities with the prosthesis specialist who is making the device. And I'll later on give you specific protocols how you can possibly do so. So if you don't have an occupational therapist, you can try to take some of his main goals and try to do it by your own. And you can see the test, it's called 9-hole peg test, and I will later on talk about it also as well. So the main idea of the course is to teach the child to use the device and motivate to do it at home. And the global goal, as usual, improve life quality, happiness, and the child's health. And moving on and talking about specialists that work in the team, let's start with the doctor of rehabilitation medicine. It's the first person who gets in touch with the patient, who collects all the data about health, who tries to set the goal for the rehabilitation, for the prosthesis fitting, who is in charge of all organization, control, coordinates, and medical documentation. And I also like to call a doctor of rehabilitation medicine a family friend. It's a person who is always in touch with the family, even after the device is installed and later on in life. And that's what I do a lot. I have a lot of phone conversations, Skype conversations with my patients, trying to follow their progress and to see if something is going wrong or everything is going just good. Kinesiotherapist. So he has to evaluate physical health. If the patient has scoliosis, if he has some muscles issues and so on. The other thing is stump evaluation, the muscle strength, the range of movement, maybe some pain issues. And the program that I've been telling you about, this teamwork takes just 1 day. I wish it was longer, but we cannot afford it to have much longer. So it's just 1 day, and it's pretty obvious for everyone who knows a little bit about medicine that you cannot change general health just in one session, in 1 day. So the main idea is to create a home program for the patient that he can use at home to improve his health. So develop home exercises and to put them in medical documentation so the patient knows what to do exactly. So here are the examples of kinesiotherapy. And so the doctor have made some evaluations and see the degree of scoliosis this girl has, this young lady has, and she's 11 years old and she already has scoliosis. So they developed a home program for her to prevent further changes. And as far as I know, she's pretty goal orientated. So she's doing it at home on a daily basis, every day. So switching on to clinical psychologist, it's hard to tell exactly what does the specialist do because it's a very individual work, and it's basically answering the question, answering the request of the patient, trying to find motivation to work with the device, trying to explain the parents how to communicate with the child so he feels different in a good way, how to explain this difference, how to teach the child to communicate with the outside world. And in terms of the adults, it's usually a trauma, and trauma is a big psychological issue that you have to deal with. And if the patient is not already accepting the thing that he have lost his arm, if he's in grief, if he's in pain and in depression, it will be very hard to accept the prosthesis for him. So clinical psychologists are truly needed. And I would like to ask you, do people in India tend to seek help from psychologists? Because in Russia, we still have this problem. People don't understand what psychologists do, and they don't understand in what cases do they need to see the psychologist, and they don't basically trust them sometimes. And it's a big issue, and I'm trying to make it different, but so far it's going really slow.
Alina, why people answering the survey, Ramach Thakur is asking, is kinesiotherapist same as physiotherapist?
Yes, it's pretty much the same. Yeah, in some countries they call it kinesiotherapist. In some countries they call it physiotherapist. We call it the third way in Russia. But yeah, it's pretty much the same. Thank you for your question. I usually tell that there are the different names for the same specialist, but this time I forgot to tell you. Thank you for asking. Yeah.
I see one answer for your question, that if you are going to psychologist, the society is saying that something wrong with you. It's a social stigma.
Yeah.
Thank you for sharing, because it's very important for us to know if in North America, you know, it's spread. I will say like these services for people But for example, in Russia, it's not so spread and nobody believes on them and so on. So in India, the situation, you see that social stigma and these cultural differences and so on.
Yeah. Well, I would say that in Russia several years ago, it was pretty much the same as in India right now. It was a social stigma, especially in the regions. In Moscow, people are more progressive because they travel a lot and they see a lot of things. And in faraway regions, they don't get to travel a lot and to communicate with people from other countries. So it was the same thing, and it was a crazy idea to tell to an adult man, you need to get in touch with the psychologist. He would not listen to you, and he would look at you like a mad person. But nowadays, I would say it's changing, and I have had several patients from faraway regions that call me specifically to ask if I know a good psychologist that they can get in touch with, because people start to understand and it's important. And I'm hoping that maybe in India the same trend will be the same as well. And well, the other issue, you don't have them. 48% of our listeners keep saying that they don't have clinical psychologists, and that's a big problem. In Russia, we don't always help them in the regions as well, and that's why we work a lot with Skype, with Zoom conferences with clinical psychologists, and it's a solution. Of course, it's better to work face-to-face without internet, without a computer in front of you, but in some regions we don't have psychologists. That's why we have to use modern things, modern technologies to get in touch. Thank you for your answers. It's an interesting thing to know how things are arranged in India.
Yeah, thank you.
Guys, short technical message. If you have a wish to go live, to go here, and to ask some questions which are worrying you using voice, please raise the hand in our Zoom conference. I will give you a possibility to talk to Alina.
Yeah, okay, thank you. Let's move on to the next issue, and we are getting close to the part of where I will share with you information on occupational therapy. And I need for you to pay really close attention to this part, because in terms of clinical psychologist and physiotherapist, you have to be a specialist to do so. So you have to either invite them to your clinic or do something, I don't know, have a partner clinic where the specialists work. An occupational therapist is always, you have to be a specialist, but I believe that part of these responsibilities can be shared with prosthesis specialists, and I will tell you why and how. So occupational therapist basically trains on how to use the device, and he has to use a goal-oriented approach. So the tasks have to be oriented on the age and on the goal of the patient, especially when we are talking about adults. We've had cases when the adult patient, a man, have been working with woods before he had his trauma, and his main goal was to go back to his work. He loved doing things from wood. He was making furniture and so on. So on the rehabilitation process, we asked to bring him all the stuff that he usually used, well, not the big one, but at least the small ones that he have to use at the part of his job. So he brought it along, and we were oriented on learning how to use the device, the prosthesis, in terms of the woodwork. And also occupational therapist tests the progress. It's a very important thing to make testing, and I will tell you why. The another issue is evaluating of the skin. So this team works exactly after the prosthesis fitting. So if occupational therapist takes off the device and see that there is some skin irritation, some wounds, some injuries, he goes back to the prosthetic specialist and tells him, okay, we have something wrong going on here. Let's make some changes to the socket, and also medical documentation as well. So and the last the next thing of the training, and I'm telling you it because I really want you to do this training, no matter if you have occupational therapists or not, because the goal is to help to integrate the device to the daily life and improve quality of health. It's a big goal, and there are some different subtasks. As to the first one is to train control, yeah, in terms of bioelectrical hand, learn to open, close, hold objects of different size, weights, and in terms of mechanical processes, to try as many manual activities as you can. And I would totally prefer this task to be done with the specialist, with a process specialist, or with the occupational therapist, if any, but not at home by the patient on his own. At home, he can improve his skills in daily activities and later on do some advanced training, search for the optimal patterns of movement. So he already knows how to cook food with the device, but he is looking for ideas how to make it even easier. And on the next slide, there was several examples of occupational therapy. And yeah. So this is what you can train with a patient in your clinic, in your prosthesis center, and you can see that you don't have to have a lot of expensive devices, expensive machines to do so. This is basically something that can be bought, can be brought even from home. Of course, I would recommend to have ergo occupational kitchen, a place where patient can try to cook food. It would be really great if there is opportunity to buy it or to bring from somewhere. That would be great, because a lot of patients have a desire to cook using the device. And these are the main differences, the main difficulties that I usually face in terms of bioelectrical hands.
Alina, I have one note for you that I think we lost the previous slide. No, you shown some tools for
some tools. I cannot say that I feel very comfortable with switching the slides, because yeah, thank you, Evgeny, for noticing it. So I've told you that I always do some testing. The testing that I've been doing is 9-hole peg test. You can see it on the picture. So you have to put 9 pegs in 9 holes. And the other test is box and blocks test. I don't know if you've heard of it or not. It's usually used with neurological patients. There are basically 2 parts of the box with a lot of colorful blocks in it. And the patient have to take the block and put it from one side on the box to the another side of the box. And you count how many blocks did he switch in 1 minute. So those are the tests that you can buy from online. They're well known, but I would say that they are very expensive. And I don't know why, because it's a very simple thing to do. And to do a scientific research, you have to buy them. But just to track the progress, you can create your own type of test. It just has to be the same all the time. And why do we need the test for? We need the test to show the patient the progress. So sometimes the patient feels confused because they feel like they don't have any progress, that they've been wearing the device for a long time and they don't still feel very comfortable with it. And that's when you kick in and you do the test and show, okay, did you see? At the very beginning, it took you 5 minutes to pull 9 pegs in 9 holes. Now you coped in 2 minutes. So you're at least 2 times better. So this is a good way to track the progress in skills. And if you don't have an opportunity to buy these different tests, and to be honest, I really want to buy a box and blocks test, but it costs around 300 euros, and there is no way to buy it right now. So I'm not using it, but I wish I did. And you can develop your own test, but make it the same. And maybe you can make up a test that will be easier for the patient to do by their own at home. So something is...
Alina, I have some comments for you about it. some times ago, I worked in Arabian Emirates, and I met one Indian who held one shop with carving things from India. And I think it's not a problem when guys doing these things from wood or from stone. Actually, this is from stone. Yes, I brought it from Bhubaneswar, and I think it's not a problem for Indian people to create by themselves. I mean, if it's huge cost, I think it's it's not so complicated construction for them.
And you can sell it abroad. I will be ready to buy it because the reason why I need to pay 300 euros for a box with several blocks in it.
Yeah, guys, if you know somebody who can create it and make it for us and for any rehabilitation clinic in India, please write in the comments what do you think? Is it possible to make it in India?
Yeah, I will give you all the recommendation. There is recommendation in terms of size of the blocks and the size of the box. They're all available. Okay, so those are the difficulties that usually the patients have in terms of the bioelectrical hand. And mainly all of these issues can be partly solved with rehabilitation. So the first problem is the need of external support. So the muscles activity sometimes happens unintended because the weight of the prosthesis is pretty big. Well, anyway, it's bigger than nothing. And usually before putting on a prosthesis, the patient does not bear any additional weight. So the prosthesis starts to involuntarily close and opens. And that's when the patient usually calls us saying that the prosthesis is broken. It's keep opening and closing, and I don't want it to open and close at this moment. And it's usually not the prosthesis that is broken. It's usually the muscles that are sending a wrong signal to the prosthesis. So the only one solution how to solve this problem is to keep wearing on a daily basis. So the hand will get used to the new weight and the muscles will stop contract all of a sudden, and the patient will be able to control the contractions better, so there will be no involuntary movements of the prosthesis. The other thing is a grip force and opening width. Sometimes, well, not sometimes, it's always when we are in stress, when we're doing something new, we're very organized, our muscles are contracted and we're trying to put everything together. So we usually apply too much contraction of the muscle. And when the patient is having a prosthesis, the prosthesis reacts and the objects slip from the prosthesis or they crash. And the only solution is trial and error method, meaning that keep trying, looking for right force and the right opening width, and it's also can be solved with rehabilitation. The other moment is coordination of both hands. We have to understand that the speed of the prosthesis is a little bit slower than the speed of a hand, because the prosthesis have to feel the contraction, have to do some operation inside of it, and then the fingers move. So usually the advanced users start the activity with the prosthesis a little bit earlier than with the hand. So if they need to hold something with two hands, they start to contract the muscles on the hand with the prosthesis earlier than on the other hand. It can be also a solution in terms of learning how to deal with bioelectrical hand. And the other issue is it's hard for the patient to control muscles in different positions. So when the hand is moving, he needs to still hold the contraction or hold the relaxation. And it's hard to do so because there are natural patterns. For example, when we extend our arm, the wrist usually opens. That's how our muscles work. So when we're trying to put something on a shelf and we're extending our arm, the fingers want to extend, and sometimes the object is lost. So the training would be put objects on different height, on different levels, train to pass objects between two hands and directly to another specialist, another person. So it's a permanent training. The other thing is repetitive grasp and release. It's always a hard issue when you have to put something to take, let it go, take, let it go, take, let it go. It's a big work for the muscle, and it's a very advanced skill. And I would say that this is the main reason why do we have compensatory movements. So when the patient is having hard time switching, holding and releasing all the time, he uses his shoulder to do so. So he's basically moving like this, and it is compensatory movement. It's not a good for the muscles, for the posture of the patient, and he will get rid of it as soon as he will feel more comfortable with the prosthesis. And the last but not the least, the need of visual feedback. As I've mentioned, the prosthesis does not have a tactile reception. So you have a lot of patients have to look on their hand, on their prosthesis, to make sure that they have the object. And very advanced users can do stuff with their prosthesis without looking. And I have a blind man who cannot see his hand if he's holding something or not, but he learned how to operate with the prosthesis according to the sound that the prosthesis is making and according to the small vibration of the prosthesis. So there is a way to learn how to do it even without visual contact. But it's a very advanced skill, and it takes a lot of time to do so. But if there is no option, the patient can do it.
Or we need technologies which can help patients to feel. Yeah. I mean, in a future.
Yes, and that's where the technology are going to, and I know that a lot of teams, research and development teams, are working on making the prosthesis, fitting the prosthesis with the tactile feelings, tactile sensation, and I hope we will go there. And
we also.
I know, yeah. Matverika is also working with these things and hoping one day we'll see the prosthesis that can actually feel the temperature or the pressure and everything. So meeting these difficulties, the first desire of the patient is to stop using the device. And that's why the patient has to be prepared for this difficulties, and he has to be explained while this happening and provide information on the progress. So you are doing better than you used to do, and so on. That's why you need tests for, and there are several scales, international scales that have been developed to show the progress and to improve the skills. And one of them is assessment of the capacity for myoelectric control. It's developed specially for bioelectrical prostheses. And it's an observational assessment, meaning that the specialist has to look on the patient and to provide the feedback, how is it going. It can be applied as soon as the patient knows how to open and close the wrist, and it's suitable for different ages, sizes, and levels of amputation. Bad news, it requires training. You can go online and see on the website of this tool, it's called ACMC. When is the training? How expensive is it? But for right now, while you probably are not leaving tomorrow to the training, you can use a part of the method, and I will tell you what kind of a part. So you ask the patient to choose an activity, any activity he likes. It can be cooking food, it can be making up a bed, anything. And you evaluate the activity with 4-point scale. So where 0 is the patient is not capable of doing something, and 3 he's very skillful and he's operating with the prosthesis very good. You're evaluating every one of the 6 features we have mentioned before. So you evaluate if there is a need for external support, if there is a grasp strength with and without support. Sometimes when the patient is telling you the prosthesis is opening involuntary, you have to ask him to put the hand on the table and to make some movement. And all of a sudden, the prosthesis stops involuntary movements. And it happens because we have taken the weight of the hand, so the weight is on the table, and the muscles work better. And it's a good way to explain the patient what's going on. You can just tell him, have a look. When the hand is on the table, you have no problems. So the prothesis is opening and closing involuntary because your hand is not used to the new weight. As soon as the hand will get used, you will get rid of the problem. So you evaluate every of these 6 points and 4-point scale, and you put on the scale somewhere, and you use it to give recommendations to the patient. For example, work more on the force of the grip, so you can see what exactly is going wrong. And that's basically how it works, and it's a good thing to test the progress as well. The thing that is usually asked is how to choose these activities. So you need to know a set of activities to buy it in your clinic. Again, if you don't have an occupational therapist, you can give these responsibilities to your prothesis, to prothesis specialist, to check different activities and to see how the prothesis is working. So the other test that tells us what activities can we use is called UNB. I think it's from Sweden. Maybe I'm wrong, but it's not Russian for sure. It's also a first specialized test in prothesis, and it gives you tasks, 10 specific tasks for every age group. There is tasks for little kids, there is tasks for adults as well. Tasks can be selected, can be changed, and I don't know if I have an example here. I think I do, and we'll go to the survey a little bit later. So how is this test used? You give the patient a general instruction. You tell them, okay, I need you to ride a bicycle. And you don't remind the need to use the device. And you evaluate the spontaneous integration of the device to the activity. So if the patient is grabbing the bicycle with the device, or he just puts the hand passively on the bike, and you evaluate if the patient is using the device or not. When you have already evaluated it, you go to evaluating the skills, and that's when you remind to use the device, telling something like, okay, and now try to hold the bicycle to make sure that you are safe, and so on. And so you develop both spontaneous integration and skills. Just as before, you use 4-point scales, and that's example of the task for a boy of 3 years old. Ride a tricycle, unclip toy clips, tear paper, open pencil case, cut a sheet of paper, or open a glue stick, and so on. And you can see that those things are not really expensive to buy, and you can use them for all the patients several times, so you don't have to buy them new all the time. And that's example of what you can see in the protocol, in evaluation protocol. Let's say spontaneous integration 4, skills 12. So when you remind the patient, he has a pretty good skills for his age. But spontaneous integration is very low, it's only 4. So the boy does not know when to use the device. He has a very weak motivation. That's how you create recommendation for your mother or for the father of the boy. You tell him or her, okay, spontaneous integration is very low right now. So you have to remind all the time, you have to give some motivational models for a baby to use the device. And the skills are okay. They will get better as soon as he will start use the device more. And later on, you can compare the progress. And that's how you evaluate spontaneity of the prosthetics use. Well, it's not a 4, it's 5-point scale. And this test is called UNB. You can find online, or if you cannot find it, text me. I will send you the document, and you will see there all the sets of the tasks for different ages. So you can form the to buy list if you decide to apply it in your clinic. And I would definitely recommend you to do so, because there are simple age-specific tasks And it's scientifically proved that this test is useful and it's good to learn how to operate with the prosthesis and to give a right motivation, a right recommendation for the child. Please don't forget that the prosthesis is always an additional function. So you don't try to teach the patient manipulate with the prosthesis too much. So the prosthesis his main function is to hold objects when the other hand is manipulating. So evaluate these additional functions. And remember that objects have to be small enough to fit in a hand, especially in the first time when you train, and put the objects on different height and different distance to make sure that the patient trains different movements. And if you have bimanual amputation, evaluate one hand at a time. So evaluate one hand, then switch to another. That's what I wanted to tell you about the tests. And once again, you need the test to train the usage of the prosthesis, to demonstrate the prosthesis abilities. And that's a very important moment, because sometimes when we don't train patients, they come at home and they say, well, the prosthesis cannot do anything. But when they have had the experience in the prosthesis center, when they've tried different things, they cannot tell you that, because they've seen with their own eyes that they're capable of doing things. So they have the right motivation. And another thing, it helps to motivate patient to develop furthermore, to give right recommendation, and it gives a good area for the research. What methods are better, what rehabilitation approaches works best with what patient. And going back to our survey, do you use any specialized tests like the ones that I've mentioned before, the UBN, the ACMC, and you can put the answer in the survey. And I would also love for you to put the answer in the chart. Do you want to use it or not? Do you see any point of it? And I see the question of Pooja, UBN, University of New Brunswick, Canada. Yes, that's true. UNB, it's the abbreviation, and the full name is University of New Brunswick, Canada. They used to have this test on the site of their university. I don't know if they have now. I have it on my email anyways. And the first test, ACMC, it was developed in Örebro in Sweden. So yes.
Thank you for your active voting. In several seconds, I will show the results of the survey. Alina, you will see almost 45% of all the participants have done their vote.
Okay.
We are more than 50 today. So 50 people, more than 50 are listening to us. And there are at least 5 participants which are watching our stream on Facebook.
Yeah. Okay, I'm glad that the UNB test is online and you can find it yourself to see more details. And yes, the ones you have mentioned, oh, that's great. That's great that you have been using the test. I'm really glad that I'm not alone on this. Yes, different ones. Oh, no, we don't use any. Well, the ones who have mentioned a different ones, I would be glad if you share with me the names of the tests, maybe in the chat. If it's comfortable for you, because I would really love to know what you are using and do you find it successful or not. Well, probably if you are using it, you find it successful. So I would really love to know your experience on it. And while you're texting me, well, hoping you're texting me on this.
If you need motivation, for example, these metallic heart could be a motivation for you. The most active will finally get the one, if you like it.
Huh. I really love this heart. I should be competing as well. And we're moving to the final part, where to get a team. And there are 4 basic options as I see it. If you see any other options, also text me. I would be glad to discuss it with you. The first option is create your own rehab center. And as for me, that's my big dream, to have my own rehabilitational center. It's an expensive dream, and you have to buy stuff, and you also have to invite specialists and give them salary and all other things. Well, you understand the idea. So it's a pricey thing to do, and I can understand that not everyone can afford it. So the other thing is outsourcing. That's what we're basically doing right now here in Russia. We are finding the clinics that we can trust with our patients, with our methods. We educate them to work with the prostheses, and they do the rehabilitation for us, and we are in charge of the process and trying to get involved if we are needed. The third option is delegate part of responsibilities to other specialists. Well, I've mentioned before, I would definitely try to delegate occupational therapist responsibilities to the prosthetic specialists. If there are no doctors in the team, I think it is better than not do any training. And the fourth option is let it go and don't get a team. It's always an option as well, and a lot of rehabilitation rehabilitation organizations go for it. And what option would you go for? Or maybe you already go for one of the options. So the first option is own rehabilitation center, the second is outsourcing, the third is delegating responsibility, or let it go and don't waste, I would not say waste, but the idea is don't spend money to provide rehabilitation. I don't know if do we have a survey for this, Nikita?
Yes, we have. Now
Okay.
you will have it.
Okay.
Just a second.
And we use cupboards, doors handle, opening, closing door. Yeah. We also use cupboards as well. Mm-hmm. Yeah, this is a part of the daily life activities that patient always face with the prosthesis, and I'm glad that you also train it with them. That's a good thing. And I know that I've missed some of the discussion about cosmetic and prosthesis. Yes, and I've heard that in India, cosmetic prosthesis is accorded greater importance than functional, except in bilateral cases. Our patients want a hand that looks like a normal human hand. Well, yeah, that's a sad thing to happen. And in Russia, we also used to have this tendency a lot, and we still have it with adult patients sometimes. And we're trying to change this reality, to provide education to the patient, to provide them with information that it's your health, and cosmetic cannot help with your health that much. But yeah, I know about this problem, and I'm with you on it. That's another problem in Russia as well.
Alina, while people are watching, 2 points for you. Point number one, Nitin shared his experience. What test do they use? You know?
Yeah, I've seen it. Cupboards, yeah, door handles, yeah, a good ones. Yeah, because it's what usually patients do in their daily life, so they need to learn how to operate with them. And I also see the answer ULPOM. I think I've read about it, but I have not tried it yet. I will do some more reading and probably will try it as well. Thank you for putting it up.
Pooja, if you want to share your experience of using this exact test, I could make you leave. Just raise the hand, you could share. And one more question. I consider it to be important, and maybe it is the questions to all our team and to everybody who participates today in our webinar. Zia asks, is it good idea to ask patients about their expectations from upper limb prosthesis, or we should just tell them about the expected function of prosthesis? What is your opinion?
I think, Zia, it's a great idea. And that's what I always put on the questionnaire that I send to the patients. What are your main expectations from the upper limb prosthesis? Or sometimes I ask it like, why do you want to put on a prosthesis? And that is when they usually write me, I don't know, I want to have more functions, or I want to lift up a heavy things because I built houses. And that's the right time to fit in and say, well, with the mechanical prosthesis, I'm not sure you can really lift heavy things, because you can only lift up to 2, 3, or 5 kilos, not more. So the patient will not be upset when he gets the device and he's trying to build his own house and it doesn't work this way. He needs to know it beforehand. And it's a great idea to ask beforehand about patient expectations. And
I have my kind of answer, because you know, your question, I consider it to be important. On the previous webinar, we discussed very deeply together with our handicapped fellows, Ilya and Mahin, why should people dream about upper limb prosthetics? You know, and different people have different expectations. Being just an bio robot who's, you know, texting or messaging what functional stuff could technological arm give to a patient, you know, it's not a very effective, I would say, idea. But being an advocate of the patient, deep in dive what he or she expects of this installation is a very good and professional approach. If you did not visit our webinar about these deep expectations of the people, what do they really expect while taking a decision to have prosthesis, you know, please look our record on the Facebook and YouTube. They are available. You will have a lot of hints, I would say, a lot of knowledge.
Yeah.
Thank you, Marco. We have another question about the expectation, and sometimes they have very high expectations. I mean, our customers and patients, what to do in such cases?
What was the question one again, Evgeny?
About high expectations. If the patient have high expectations, what we should do as a professional?
If the
what we should
expectations are too high, if you know that there is no way you can meet them, you have to tell them the truth. I usually start with the phrase that I have to be honest with you, and I'm a doctor. That's not my duty to sell anything to you. So I'm going to provide you with the honest information. This thing you want to do with the device is not possible. This thing is possible, but this one is not. If you are ready for it, if you will be satisfied with other things that the prosthesis can do, we can go for it. But if this is the main idea why you want to get the device and we cannot meet this expectation, please make sure that you're okay with that. And sometimes we have a very complicated cases of the wrists when the patient is having proximal parts of the fingers and the device is very big, it's huge. And that's when I call the patient saying that you have 3 options. First option, not to put any device at all because it will be huge and it will be not comfortable to use it. Second option, try it and see if it will be okay with you or not, but there will be some function missed and the size will be big. And the third option goes to go to the surgeons and do another amputation of the rest of the fingers, so the prosthesis will be not that big. So that's an example of working with expectations, and it's the patient choice what he wants to do. If he's not ready to go for the surgeon, but he's ready to try and be prepared that maybe it will not work and will not be comfortable, it's okay. But we have to warn him that there are several opportunities for him in this case. And
yes, I hope we answered for Zia's question. Thank you so much.
Zia says, thank you for such a detailed answer.
Yeah. And I can see the results of the vote. What options would you go for? And I'm a little jealous that 61% are ready to start their own rehabilitation center. That is
Welcome
great.
to India. Welcome to India, Alina.
Yeah, that is great.
Entrepreneurship country.
Yes, and this is great. And if there is anything I can do to help you with it, with the specialists, with the equipment, please feel free to contact me. Evgenia and Nikita can share my personal email and my personal cell phone, and I would be glad to help, because it's a huge thing to do, and I hope you will get the results that you want to and that you expect to get. Outsourcing, yeah, a good option, I think, and that's what I go for right now. And delegating responsibilities. Yeah, if there are any information I can share with your specialists that are going to be in charge of occupational therapy or something else, let me know. If there anything I can share with you besides what we are discussing today, I totally will. I would only ask you not to let it go and to get the team. Don't use the force option. And I can see that no one voted for it, and I'm glad you didn't. And we're close to the end. And what do we do after prosthesis? This is a very, very important part. Please don't miss it. You have to provide continuous support to the patient. He has to feel that he's not alone, that the team is by his side, and you have to provide individual approach to motivation. And we're having a project that we have recently started. We're shooting videos for the parents of children that they are going to watch during the first month after the prosthesis installation. And through these short, really short videos, I will give them information about why is the device important, how does it affect health, what should they do at home. So brief and really, really important information. And after this informational vlog, they will see an example of the task that they can do with a child. For example, I've developed different types of games there, and I can send it to you. Also, it's in Russian, it's not translated yet, but if you really need it, we can go for it and translate it. So there are tasks for the children, short tasks like to sort different types of objects by size or by color using your magic hand and so on. So it's all type of playful activities that the parent can start to do right after he watched the video. So during the first month is a very difficult month, and it forms the success in a big way. So in the first month, he's not alone. He knows what to do. He knows who contact now and later on. This is an important thought. So be there, call once in a while. I usually call in 2 weeks after the installation. Then our specialists call in 1 month, 3 months, 6 years, and 9 months, asking if there are any questions. Are you wearing? Why you are not wearing if he is not? So all this type of information, and offer help if there are any problems. And the other thing is forming a community. Most of our patients have never seen another people with the same problems before they get a device in our team. Mm-hmm. And it's a big issue, especially for children, because you know that you're different and you have never met anyone like you, and it's scary. It's like I'm alone in this world and I'm the only one who has one hand. And we have formed a community. It's online. It's a chat of the parents of adults with the same issue who got or who are about to get a prosthesis. So they text each other, they support each other, they share video of their success, and they provide each other help that sometimes I'm not able to provide them, because it's their experience, it's their life, and they're being very supportive to each other. And they even meet once in a while in their countries, in their cities, and do some activities together. And it's a very important feeling that you are not alone. So I strongly recommend you to create some type of a chat for your users where they will communicate with each other and share how is it going with the device.
My dear fellows, I would also highlight the point about community, which Alina now somehow mentions to you and pitches to you. Alina is talking about community in a very human-centric way. You see, she is a professional and human-centric professional. She really takes care about these people. But I would also give you a very strict reason to take care about this community. What do I mean? What is this reason? You know, we in Motorica in Russia have often cases when parents or teenagers don't want to become cyber heroes, don't want to install prostheses. And nobody from our team could persuade them. You know, we consider ourselves very persuading. Me and Evgeny and Sean, we are very persuading. We have a great experience of persuading people or engaging them or, you know, inspiring them. But to be very sincere, we are not in their zone of trust. You know, we are not in their zone of trust because we are analog one traditional people with two hands, you know, and inside them, they don't trust us for 100. As for example, I would not trust a man who is teaching my child or son to play football if he never played football, you know, and he did not have any championship in his life. So in Motorica, we ask our ambassadors, we ask our community representatives to talk to these people and to share their experience, how prosthesis changed their life or not changed, what it really gives and what it does not give. And after this, the major part of these people who did not want to install prosthesis, they decide to rush, you know, and to change their life. That's the story. That's why community is important. It's not about only support and sharing the experience. It's also about inspiring people to become, you know, Kibi heroes, like we call them.
Thank you for a comment. That's true. It's always easier when you have someone who is like you talking to you. That's true. And I would say that I would like to give a word to Evgeny because the next part is about VR rehabilitation. And he somehow had more experience with it than I did. So Evgeny, I would love for you to share your experience and your knowledge about it. And if there are any questions for me, I am still here. I will be glad to answer you later on.
Okay, thank you, Alina. Thank you so much.
Before Evgeny would start, my short notice, we made a survey to you and we're asking what the time of the webinar is absolutely comfortable for you. Major part of you, our dear fellows, smart prosthesists, you answered 1 hour and 1 hour and a half. Now we are together 1 hour and a half. If you want a bio break, somehow to drink some water, to drink some tea, you could use these small pauses before Evgeny will pitch us the second and also a very attractive part. So please, take your time.
Thank you, Elena. Evgeny, before you start, I think most of the time when we traveled, there were some questions by our partners or people who want to partner us, is what is the space required for VR? That is one concern. Second is this technology, VR technology in terms of hardware, can it be locally sourced, was a second concern. And the third concern is, if we do have this VR facility, how do we extend it to smaller cities and smaller townships in the country? India, as you know, there's a vast population. There is a limited resources available in small towns. I mean, VR is the future, which we are offering India. It's a superior product. and people, the interaction also can be monitored. So I think obviously you will be covering it in your presentation, but if you could highlight these features during your presentation, it will really help many questions moving forward. Thank you, and all the best for your presentation.
Sure, Sean. Thank you for your good questions, and I have answers for, I hope, for everything what you are asking about. Yes, and I think, guys, not to waste your time, we can move forward. I will have, I think, maybe 15 minutes speech for you. It's about future technologies, how to combine offline rehabilitation with different tools and with different digital technologies. Yes, and I want to ask Marco to give me the possibility to use my slides.
Already done. Already done.
Can I switch it?
Yes.
I can't.
Now you could make it.
I can make it by myself?
Yes,
or
yes, yes, you can. Please move the mouse. Yes.
Okay. Okay. So actually, I want to start the small story about virtual reality and how this technology can help. So I think from 2010s, this technology appeared in the world, I say like this, and right now it's developed technology for mostly for entertainment, for games, for videos, yes, for 360 views. But a lot of people right now make a research about usability of virtual reality in case of rehabilitation. And right now, a lot of universities, a lot of companies are making their researches and making their own product for people, for different types of traumas, for spinal cord injuries, for neuro rehabilitation, after stroke therapy, and rehabilitation after limb loss. It's our team, it's our competence and our team. We are making our own product from this field. And what is the difference between usual rehabilitation process and rehabilitation process in VR and with gamification? Right now, gamification is a trend everywhere. Gamification, you know, in your job, gamification in some games, gamification everywhere. And right now we are talking about gamification of rehabilitation process. And something wrong with my slide tag. Yeah. Here you see that a lot of injuries can be treated, or VR can be a part of a treatment which engage people and make the process more attractive. Yes, and one thing I know from my patients, they said to me that it's a little bit boring, you know, to use some cubes and put it from one place and replace it to another one. It's a little bit boring. And how to make it attractive, how to make this process you know, more engaging for these people, and we add new technologies for it, and I will show you what is the main and interesting solution, and what is the 4 goals of this treatment. First of all, and it's already, you know, proved by a lot of scientific research that it's treatment of phantom pain, because people, they see their own hand inside of the game. Yes, inside of the virtual room, they see their all hands, yes, there, and they trick their minds from this point of view. Second point, it's muscle activity improvement, because we use this the same myoelectrical belts and myoelectrical controllers to use prosthesis, artificial prosthesis inside of the game, to manage it, to hold objects, to release objects. yes, and to make some you know, small interaction with objects and create some games inside. Yes, and for our people, we use it like a training before prosthetic and training after installation of prosthesis to improve their you know, process. Because as Alina said, I wrote to my notebook that different distances of the hand which our patients should use, it's a little bit complicated, but inside of the game, it's more attractive to understand how to use different muscles. When you're, for example, you use a bookshelf, yes, and you need to take the book and to hold it and to put it on the highest shelf. I think with these small examples of tasks for them inside of the VR, the process becomes more attractive. My slide deck is going forward without me.
Yes, it happens. Sorry, Evgeny.
Yes, and it's immersive. It's immersive, it's much more attractive. It's one thing. Second thing, that not only Motorica, yes, and Otto Bock and guys from the Vienna University of Technology in 2012, they shown some prototype of this technology. But unfortunately, that time, we didn't have an access to this technology at all. It was only research. And there were not so much, you know, options to buy VR, not so much producers as nowadays, yes, and they didn't have an opportunity to penetrate this technology to the market. Yes, and right now the accessibility higher, and right now we can use just simple kit from the nearest shop or from internet shop, from Amazon or any other source. I found some from India Mart. Yes, I will show you a little bit later. So yes, we present our, what happens with my slides? Yeah, sorry guys.
I could manage. I could manage.
So yeah, here is our date of release. Yes, we presented in Germany in 2018. We use it right now for our rehabilitation process inside of our rehabilitation clinic and office. Also, we present it in OPI and also in some international exhibitions. Yes, you see a lot of Indian people, and they were a queue to our stall there. Actually, a lot of people who wanted to use it, and I think Sean remembered it, that time that a lot of people during OPI was just staying nearby and asking, what is this? And we show what is the new technology, how we want to implement it, and so on. Sean, did you?
Yes, I think we had many people who came in, and it was a surprise for them. You know, they never came across this kind of a technology in such a restricted space, you know. So it was a highlight at OPI.
Yeah, thank you. So here, actually, you see the full kit. Yes, you see our team members, you see our cyborg in front of you. Yes, and you see two, actually, tripods with cameras and some stuff on the background. You need just TV, some powerful computer, and VR kit with 3 folds. Yes, there are not so much space. I will show you a little bit later about it. And right now I want to go with a short video about gameplay, and the name of it is Atilan. We have it separate, a new age of rehabilitation with combination of clinical processes of rehabilitation. You can engage people and show them that you have actually advanced clinic. Yes, the most technological clinic who works with amputees, who works with these types of traumas. Yes, here you see how our patients, they prepare for cybathlon. Cybathlon is competition, usually it's from Switzerland. Yes, competition between people who wear prostheses. Yes, and here you see how to manage different things. And inside of the game, our patient have 2 hands, one hand with prosthesis and one hand without. They use joystick for the hand, and they use special myoelectrical belt, which has a connection to the thumb with myoelectrical sensors inside. They can use both. They can use different unusual things, which they actually can't to use in their real life. And also they can see, for example, Mars, because we have our training room near the Mars, and we download, you know, our developers, they download the background and very good quality photos of Mars. Yes, and add it to this game, you know, to show that the future is somewhere nearby. Sean, I want to answer for your first question about what I need to start. Yes, first of all, you need to buy the hardware of HTC. It's available in the Indian market. My electrical bracelet of Motorica and software of Motorica. We will install it remotely to your computer. Also, you need a computer with you know, good capacity, and I think one monitor. Doesn't matter actually what's the size and so on. And also you need from 2 to 8 square meters. Actually, it's possible to use in 1 square meter, but it will be not so attractive for your patient, and you don't need you know, so much space. And also you need one specialist who will guide the patient during this session. Yes, it could be not you know, professional from rehabilitation field. It could be just some technician or somebody else who can guide your patient. I will show how it looks like in our office, and our patients, they share their experience of doing it in our office. Unfortunately, it's in Russian, yes, but I will translate you. So our engineers, they install for her myoelectrical bracelet. They're making some gymnastics right now. Guide her. She holds her glasses. Wear glasses. And she's talking about that he saw the Mars, he saw the stars. Our professionals are talking about the process which could be more attractive. Yes, and there are not so much space that required for it, and not so much equipment. And you can use this equipment for, you know, any type of activity, not only for Motorica software. Actually, I read a lot of researches, and I saw some research about VR rehabilitation of lower limbs. I didn't get the view how it looks like, but some guys from American universities, they made this research. So I just want to present you last figures and what I found that for 60,000 rupees you can buy hardware of HTC on the Indian market. My bracelet from Motorica, the cost of it is $75, and the software of Motorica. Right now we have two options. We can charge for one patient for 4 rehab sessions. Yes, it will be one rehab session for your clinic, and you can upsell for your patient inside, and we can connect one clinic for 1 year only for $980 with infinity rehab sessions, and you can integrate it for 1 year and share with us your experience. And also with our partners with SureHub, we have some motivation program, for our best clinics. We will provide this software for free. I think it will be available from July or August. Yes, depends on the current situation. You need only to buy the hardware and the My Electrical bracelet, and software will be free for you guys. So from my side, it's all. I briefly tried to explain you main options of VR rehabilitation for amputees. Yes, and if you have some questions, you can ask our colleagues from SureHub. You can ask me, or you can ask Sean about it. And I have last question for you guys. What type of rehabilitation you prefer? Usual one or digital one? Or you want to make a combination of it inside of your clinic? What do you think? Marco, can you start the survey?
Yes. Just a second.
And can I really briefly kick in while we're having this array in terms of, I can see another interesting question, which is from Abu about functional rehabilitation for upper extremities. And I also find it extremely important. As far as I can understand your term, we're talking about mimicking actual ADL activities in daily life and doing functional training to achieve them. That's what I understand as functional rehabilitation. Please let me know if you are talking about something differently. And in which area do you feel most difficult, and how to overcome the difficulties in functional rehabilitations? Well, unfortunately, we have only 1 day inpatient training in terms of functional rehabilitation, and we have an occupational kitchen where the patient try to do as many functional rehabilitation activities as they can. Also, they have an ability to try vacuum cleaner and all the stuff that we have in our daily life and daily activities, but that's only 1 day. And it's usually not very enough. That's why right now we're starting at distant functional rehabilitation activities. I don't know how it will work or not. I will be glad to share with you the results as soon as we try it. But the idea is to gather together with the users Zoom, and to try some functional activities together with adults, for example, tying the shoes and stuff like this, and cooking together online in Zoom with the prostheses. And for children, we've already tried it. We've made some kind of a hat from the paper with a scissor and with a glue stick, and there were around 7 kids with their parents, and it was really great because they could see each other online and they could communicate with each other, and they could see how are they doing. And the kids were really small, 2, 3, or 4 years old of age, and I was really scared before it all started, how will they react, but it all went great. So I would recommend to start to apply functional rehabilitation online as well. I find it useful, especially from far regions. Of course, inpatients is even better, but online is another solution that can possibly help. because my main difficulty is that we don't have enough time to work in patient. And if we could have time, I would train a lot of activities in the kitchen, cleaning activities, and work-specific activities. So something that the patient does as his job. That would I recommend. If there anything I didn't answer on this question, let me know. I will try to share some light of it. And while I got the microphone, sorry, Evgeny, I would like to thank you all for listening. It's been a long time, 2 hours, and I understand that everyone are being very busy these days and it's close to lunch break. Thank you for your question. Thank you for sharing your experience. I've wrote down some notes for myself to read more about what you wrote in about functional tests and so on. So thank you. It's been very useful for me, and I hope it was useful for you as well. If I can help with anything else, let me know.
Abu, did we answer your question? I made you an enter.
Yes, I got this. I got clearly. She told everything.
Great.
Okay, I'm glad I could help. Thank you guys again.
Thank you, Dr. Elena. Thank you very much.
Thank you, Abu. Thank you for the question. Thanks.
Thank you.
Thank you, Abu.
Okay, guys, I think in conclusion, we will show the results of survey. I'm glad to see that a lot of people, they want to use usual and digital rehabilitation process. And I think in the future, as a team, we will create all possibilities to make it together and implement this approach together for your clinics.
Now we have the announce of the most desirable webinar ever constructed to be launched for India, smart prosthetists. Yes, Evgeny.
Yes, yes. I think during our next session, you will see how we works. We want to share our knowledges, how we works right now with our patient, how we create this, you know, influence, how we create the process of interaction, and also how we can earn money, because it's very important right now.
Yes, ladies and gentlemen, I would also make some teaser to the next webinar, and we started every webinar together with you with the agenda or the statement. These lockdown times are the precious moments to learn about, you know, because when we are in a rush, we are in a process, we have no usually time to learn and to deep dive into the products in our customers, patients, and to learn new tangible things. And our previous webinars were somehow devoted to cover this goal, I would say. But webinar number 5, earning money during a lockdown, is very pragmatical one. How, what should we do to earn money during lockdown? Understanding all the restrictions we and our patients have in our days. So anybody who is interested to have answers, to have it first in the market, is warmly greeted, is warmly invited to this event.
Great, thank you, Marco. Thank you, colleagues. Thank you for your participation, and have a good day. Be in touch. Keep safe.
Thank you. Have a great week.
Yes, stay safe.
Thank you. Thank you.
Bye-bye.
Bye-bye.